Lung cancer is the leading cause of cancer death among both men and women in this country, mostly because it's usually not found until later stages.
So today in Your Health with Bellin, Dr. Isam Habib and nurse practitioner Miranda Hintz from the Pulmonary Center are here to talk about a lung screening. Good morning to both of you.
Good morning.
Good morning.
Well, let's talk a little bit about this test, how to get it, and explain why this screening program is so important.
Right. As you mentioned, lung cancer is the leading cause of death among all cancer deaths in the United States. It claims more than 150,000 lives every year. And that's because of two things. Because there is still prevalent smoking in the society, which about 15% of people are actively smoking. And second, because most people, when they're presented with signs and symptoms of lung cancer, it's late in the game. It's an advanced stage. The options of treatment is limited, and their survival is modest.
Well, even though they are late in the game, let's talk a little bit about what those symptoms are.
Like Dr. Habib mentioned, a lot of times the symptoms are not found until later on. So if you have a chronic cough that just doesn't go away, coughing up blood, losing weight unplanned, all those things are things that your doctor should know about.
Okay.
Is there anything that people can do in the first place to develop lung cancer from occurring?
Correct. I mean, there are two strategies to decrease the burden of lung cancer. The first and most important strategy is prevention. If you're not a smoker, don't smoke. And if you are a smoker, you need to seek help to quit smoking. That's very, very important. And the second strategy is screening. You know, we need to discover lung cancer at early stage so we can give the patient the chance for good treatment and good chance for survival.
All right, so let's talk about what this screening test in particular involves.
Luckily, insurance companies are now covering lung screening, and this is new. They're only covering high-risk patients at this point, so it's patients in the age group between 55 and 77 that are current smokers or have quit within the last 15 years and are not showing signs or symptoms of lung cancer. They also need to be current smokers.
And there's something called a pack history that plays into this. What is that, and how do we figure it out?
Well, it's an equation, mathematical equation. So if you smoke 1 pack of cigarettes a day, you multiply that by so many years of smoking. So if you smoke for 30 years, you multiply 1 pack times 30, it's 30 pack years. So if you smoke 2 packs of cigarettes a day, multiply that by 30, it's 60 pack years. And that will give us an idea about the amount of smoking occurred over years.
Okay. What actually happens during the screening? Is there a scan? Is it a conversation? What happens during the screening?
Well, the screening process is not only a CT scan. It starts initially with the patient discussing the whole situation with the primary provider, who talked about the screening process, identified the risk groups, talking about smoking cessation. Then the patient has to go through smoking cessation programs, which is a core part of the screening program. Now, after that, the patient will go to something called low-dose CT of the chest, which we look at the chest in details. The radiologist will read the X-ray or the CT scan. All the information goes to Miranda, which communicates that to the patient if it's negative, and schedule the patient for annual test, chest CT scan. If the CT is positive, meaning we find a suspicious lesion, then a multidisciplinary meeting will happen where a pulmonologist, a cardiothoracic surgeon, a radiologist, Miranda will be available, and we'll all discuss the findings and we'll come up with a recommendation and a road plan for the patient.
The first
team approach.
Absolutely. Yeah. Talking to your primary care provider, though, first step to figure out if you are eligible for this screening, and you can request a referral actually into their program.
Yeah, just head to bellin.org for more information. Thank you so much to you both for raising awareness about this.
Thank you.
Thank you.